In delivering his address last night, President Cyril Ramaphosa said the government would look into ending the national state of disaster as South Africa is ready to enter a new phase of the COVID-19 pandemic. For her reaction, we're joined now by Dr. Tlaleng Mofokeng. She's a medical doctor and the United Nations Special Rapporteur for Health. Dr. Mofokeng, thank you so much for your time. The President did mention COVID-19 vaccines, Africa's ability to produce those vaccines. He also spoke about the injection of health workers into the system, 56,000 health workers injected into the system. But is that enough to plug the gaps and compensate for the amount of workers we're losing to the private sector and overseas, for example?
So I think what's important to note is that the President spoke about South Africa being a developmental state, which is correct. And I think he then focused a lot of his solutions by relying on private players in the private sector. And we know when it comes to the right to health, the state actually has an obligation to ensure that third parties do not interfere in the realization of the right to health. And that is, I think, one of the most important issues, especially when it comes to health system strengthening and health financing with the move towards NHI. Now, the most important thing I think also that stood out for me was the numbers that he shared about the uptake of healthcare workers. And I was just quite inquisitive in terms of where were they coming from. Were they previously unemployed graduates in nursing and medicine? Were they perhaps the retired nurses who then plugged in? We welcome the fact that community healthcare workers have been integrated and have been made a part of permanent, members of the health system, which is something that the communities have been, advocating for many years. But I think we need to look at training and increasing capacity to train our own healthcare force and ensure that they work in healthy, and safe working environments, which means this actually benefits both the patients and the health workers ultimately.
There's a lot of things that didn't get a mention. For example, the HIV epidemic, and that fight still rages on. Thousands of deaths every year, hundreds of thousands of new infections every year. How does that fight need to be amplified?
I think what's critical is that South Africa's HIV, adolescent health, and a lot of sexual and reproductive health services are still at the mercy of global funders, international NGOs, and other foreign aid in terms of other states. And although this is good in terms of international cooperation and assistance, we have to make sure that the fiscus is able to sustain its own programming. And so you will find that because of COVID-19 and the global pressure on resources and health funding, the allocation is very different from what the donors are allocating funds for, which directly impacts our own ability as South Africa to actually ensure that programs continue on the ground and actually they expand. We need to be focusing on prevention measures, actually. There's still a good case for South Africa to embark on a public-wide information around the availability and the use and why PrEP is so important, which is the pre-exposure prophylaxis for HIV, for example. I think what's also important is that, we have to talk about the violence in this country as a major obstacle for the realization of the right to health. And for many people, we are either navigating everyday life under the threat of violence, or we are survivors of violence, or we know someone who's experiencing violence. And without a comprehensive and proactive way of firstly telling us how much resourcing will go into the Council for the National Strategic Plan, how much resources he's mobilized long-term for this, and also the council and the executive team that will lead this. I think it's been a long time that this country has been quantifying, right, the amount of violence, but we are not making enough links between the cross-cutting issues and the way that violence restricts us actually from being a truly developmental state when we have majority of this country being held at ransom every day because of violence. And so we can't participate in the political sphere, in the economy, in the social sphere, in civic spaces, just simply because of fear of violence and crime. And that's the biggest contributor, I think, to why the right to health violations continue in this country. But I think there's an opportunity for the president to show political will, which up to now is still missing.